Greetings from the set of Metro and More at Metropolitan Community College, serving more than 50,000 students with over 120 programs at our 8 locations in the daytime, evening, weekends, or online.
Hi, I'm Margaret Booman, and this is Metro and More. More of what you need to know about Metropolitan Community College. Start here, go anywhere. On today's show, we're going to talk about Metro Community College's Health Information Management System. And we have as our guest in the studio today, Mary Cantwell, who is coordinator of the HIMS program here at Metro. Welcome.
Thank you.
Nice to have you here.
Good to be here and get the information out there.
So we'll talk a little bit about what HIMS means. That's an acronym for Health Information Management Systems, but there are 3 programs within that structure, correct?
Correct. Within the associate degree, you can specialize in 3 different areas. One of the most popular is what we call the coding and billing. Mm-hmm. So what happens in that arena is doctors dictate, and it's in words, which computers don't like. Computers want numbers.
Okay.
So we take that doctor's dictation and we convert it from an office visit to a number 99212, because then the computer will take that.
What's that number mean?
That means an established patient minimum visit.
Okay.
And then the same with the diagnosis. We have to tell the insurance company why the patient came in. So the doctor saw the patient for carpal tunnel.
Right.
Which the computer is going to see as 354.0.
Okay, so the 3 programs that I was wondering about were called Health Information Technology Program, right? And then you have HCIA.
Those are 2 different programs or departments that aren't with HIMS. I mean, we're in the same arena, but they're different.
So we're going to focus today just on Health Information Management Systems programs. And the reason that we're doing that is because this is a growing area in the job market, correct?
It's huge. It's huge because there is so many opportunities for jobs now. Because of the government public health care, you've got people having more access to doctors and hospitals that they didn't have before. Well, you need more doctors, you need more people to keep that data and arrange that data. So the coding and billing, the medical language specialist, and also the office management people, you need them. You need more people. They say in 2 years we need 35% more people in the HIMS field than what we have today.
Wow.
That's huge.
You're trying to fill that need.
Right.
Then.
That's huge.
So you mentioned 3 separate areas there. Medical coding and billing.
Correct.
Medical office management, and medical language specialist.
Right. The medical language specialist used to be the transcription. Well, with the onset of electronic health records, we don't have people sitting and typing what the doctor dictated into a recorder anymore.
Right.
But what we do have is someone who has to review that documentation. To review it, they need to have, proper grammar skills. They need to know medical terminology so that the doctor's electronic record makes sense.
Right.
If it's missing something, a transcriptionist or medical language specialist would know of something that it's missing and be able to give it back to the doctor before it gets any further.
So what kind of career opportunities are there available in these 3 areas that we're talking about? They're not really interaction with the patient.
No, they're all non-clinical.
In the office setting?
Right. And some are at home.
Okay. Wow.
And that's a big deal for a lot of people with children, in school, grade school, or still at home.
What kind of job could you do from home in this area?
You could do the coding and billing, and how it works is the doctor's office or hospital sends you the records over the computer. You code them and send them back. And many of our hospitals here in the Midwest and Omaha have people working at home. We have national corporations that have people working at home. They don't have to have office space for them, and they still have to have a set schedule. but they can sit at home in their pajamas and work.
That seems nice, doesn't it?
Especially in the winter.
So you have the transcribing or the translation of the doctor's notes, and the medical coding and billing is a bit different, right?
Well, the medical coding
Or
and
is it
billing,
part of it?
that's what they're doing
Okay.
in the medical coding and billing.
All
They
right.
are taking the doctor's documentation, and we use 3 coding manuals. CPT, which is the current procedural terminology, and that's all the procedures,
Yes.
radiology, lab, anything that the doctor does to you.
Right.
And then we have to give a diagnosis for that, which is ICD-9, which stands for International Classification of Diseases, 9th revision. And that's maintained by the World Health Organization, or WHO. And that's international. That's all across the world. And then HCPCS was a level designed by Medicare some years back. They didn't like all the codes that the AMA had, so they developed their own set of codes. So we have a level 1 AMA and a level 2 Medicare.
Is it
So-
memorizing a lot of codes?
Well, no.
Or, I mean, I'm just trying to
Yeah.
figure out what this would be like if I took courses to get a degree, an associate's degree in this.
It's not easy, and people think it is. You have to have a strong background in medical terminology.
Okay.
You have to know disease process. You can't code a disease that a doctor gives you if you don't understand it. So let me give you an
give me-
example.
yes.
If a doctor says the patient has diabetes due to retinopathy,
You mean retinopathy due to diabetes?
you can do over the way. If they have
Okay, okay.
diabetes, you know.
Yeah,
either-
yeah, yeah. Okay, whatever.
So
Yeah.
they say diabetes has caused their retinopathy,
Yes,
or they have
got it.
retinopathy due to diabetes. Well, the diabetes always has to be coded first, because that's what's causing the
Yes.
problem.
Okay.
Well, if you don't understand how disease process works, you're not going to understand the guidelines in the ICD-9 book. And it goes the same with fractures. And, you know, like say you have a fractured ankle, and the doctor's going to do an open reduction of that ankle. He's going to open up your leg, and he's going to repair it. That doesn't mean the fracture's open. That just means the repair had to be done open.
Very interesting.
So you have to know the terminology, and you have to understand it by anatomy, physiology, medical terminology, and then they also have to know the insurance guidelines, the rules.
That's huge. Is
a
it a
lot.
detail-oriented work, do you think?
Very detailed.
Okay, so that's important to know. I don't think I would be a very good in this field because I'm more of a big picture person who likes to throw out lots of ideas. Details drive me crazy, so it wouldn't be a good option for me.
And some people it's not. You
Yeah.
if you like crossword puzzles,
I love
that's
those.
what you're doing. Well, you're
That's
putting
true.
the pieces together.
Or Sudoku, or all of those.
You might be able to
Hey.
do it because you're taking, you know, every part of the puzzle and putting it together.
Right.
For that patient's medical record. And I mean, it does get easier the more you do it. Like anything, the easier it gets. But when people first see the manuals, they're like, whoa, that's a lot of information. But if you do a specialty 8 hours a day, 5 days a week, say you're a cardiology, you know, there's only so many ways that they can fix the heart, the
Right.
valves. You get used to the op reports and you get used to the office visits. You do end up memorizing the codes, you really do.
Right.
It's the family practice where they see the whole bulk of everything that
Yes.
you're going to use the books more often. But that would be, you know, a very experienced, seasoned coder that wouldn't use the books.
Let's go to the website that
Okay.
we have for HIMS and kind of show people what we can see on the website and how they can use it to decide what courses that they
Okay.
can take. So we get to this first page on the Metro Community College website, Health Information Management Systems. You can take a look at job and salary expectations. What would you find there?
They're going to tell you it's not only working in a doctor's office. If you have a degree in, or your associate degree in health information management, you're not confined to say, I'm always going to have to work in a physician office. It can be hospitals, long-term care, short-term care, physician, dentist office, insurance companies. Insurance companies need people that know the codes. You could be a consultant. You could be an educator.
Exactly. Look at this. The average annual income is $55,676. That's a good salary.
Exactly.
And you get this I mean, basically you get an associate's degree, right?
Correct. You'd have an associate
years of school.
degree,
Yes.
but then you have to have the credentials.
Sure.
There is two bodies. One is called the American Academy of Professional Coders, and they credential people on the physician and outpatient hospital side.
Okay.
HIMA, which is the American Health.
Before we go further,
Okay.
I want to have put up your, I'm sorry, after this website, I wanted to have them put up your name on the screen.
Okay.
With all of the symbols behind it. That will give us an idea of credentialing, right?
Okay, you bet.
So your name, there, look at all those
Okay, so I have
letters
taken
behind it.
exams
Yes.
for every one of these credentials. The main one from the American Academy of Professional Coders is the CPC, which is the Certified Professional Coder. And then they have another exam is to teach their curriculum so students can sit for the exam and pass it to become CPC. So that's Certified Professional Coder Instructor. And then the hospital, the H is for outpatient facility hospitals, ambulatory surgical, ERs, not inpatient billing. And then the P is for the payer side. So
insurance companies?
Right, the
Yes.
insurance company. If you're going to pay the claim, you need to know what the codes are and what the rules are. So there's certification there. And then the RHIT is from the American Health Information Management Association, and that is a registered health information technologist.
So basically, you have expertise in every background known in this area.
They still have a lot. They specialize then, they can go down the line in cardiology, neurology,
Wow.
radiology, intervention. You can become more specialized.
It would be fascinating to learn all about, say, those specific disease processes within
Right.
cardiology or endocrinology or whatever.
Well, you know, when you take your CPC, we are doing every system. You know, we are teaching how to code every system. But when you specialize and do that all day long, you know, they're going to get into much more intricate surgeries than they may see on the exam.
Right.
But to be CPC, to get a job, you have to be CPC in this area.
Let's go back to the website
Okay.
and talk about some of the courses and degrees that are available under the umbrella of health information management
Okay.
systems. So what kind of we talked about the certifications, the degrees that they will come out of Metro Community College with would be?
Would be the associate degree
Right.
specializing in coding and billing.
Okay.
Or associate degree specializing in, we have medical transcription up there, but we just recently has changed to medical language specialist.
Ah, okay.
And that's what AUDI is what they call it, is from the HIMA that used to specialize for the transcriptionists. They are calling them language specialists. And then office management, we don't have any credentials, but there is a certificate that you can get from the American Academy of Professional Coders after taking a test on the office management. And we haven't started that yet, but we do teach the classes for it.
So how do you know, when you're a student first entering this field of study, how do you know which category, where to go in terms of where you specialize, or if you want to?
Well, a lot of it takes the instructors, or you know, or would they come and sit with me sometimes when they first come in if they don't know what they want.
Right.
Or when we have them start in their first class, it's called Healthcare Careers. And it opens up all of the careers that you could possibly go into in a non-clinical setting, which is no patient touching, that they get to learn about. So maybe they didn't even know about coding, or maybe they didn't know they could go into office management or go into the insurance side. So that very first class they take teaches them about all the different organizations that are out there and the different jobs. So they kind of get an idea there, well, I think I want to try a couple of those classes. I've had students in the office management that once they heard about the coding, they ended up getting the dual, because then they can take it both ways.
An associate degree in
And they'd have the two specialized.
dualities. Wow.
Yeah, coding and billing and office management.
I found it interesting when you told me too that a number of students are getting their degrees now in HIMS when they've already been, say, a nurse.
Right, we have a lot of students. You know, nurses do so much lifting and it's bad on their back. So at some point in time they can't lift those patients anymore. And we have a lot of our students that are nurses that want to stay in the area. They don't want to retire. And with their medical background, it's just a perfect fit for them. They have the medical knowledge. Now they just have to learn the coding aspect in the insurance world, and it's a perfect fit for them.
It sure is.
It's really nice. We see people that get displaced from, you know, maybe an insurance job because they downsized, that come into our program. They have the insurance background, but now they need the medical and the coding because maybe they weren't taught that, you know, when they worked at the insurance company.
Are there internships that a lot of the students take before they actually graduate? They do.
Yeah, for associate degree, you have to take an internship, and we have they have to complete 160 hours.
Okay.
And we have different sites. I have about 50 different employer sites in Omaha, Fremont, and Lincoln that will take our interns. And then they sit with the supervisor employer and they decide what 5 projects that they're going to have them work on. Now, most companies aren't going to let them code because they may not be certified yet, but they put them on the back end and they see the claims that have been rejected, and so they do the search of why they were rejected and look at the codes and the modifiers. Or they have them work on the electronic health records, scanning and making sure that they're going into the correct part of the records.
How is the issue of getting more electronic health records out there, how is that influencing the need for more people in this area?
Oh, I mean, it's huge. They thought originally that electronic health records, they wouldn't need as many people.
Right, it would make it easier.
But we need more.
Okay.
We need more.
Tell
I mean,
us why.
The records, even though the doctor does his dictation electronically, it still has to be looked at to make sure that what he documented, the code matches it, and he has his diagnosis, he has the right medicine, that the proper grammar's in there. So you need that document reviewer. So you still need that person there. You still need somebody to audit. Is there a medical necessity for what he did? So they may not all be coding straight from the book, they may be doing auditing, which auditing is a huge industry. I mean, that's another job that Medicare is hiring, the RAC auditors are hiring. So
insurance companies do a lot of auditing, I mean, to make sure too as
I mean,
well.
they can go back 3 years.
Wow.
So, I mean, auditing is another job that coders can get after they have experience. They can go into auditing. So you really need more people because that electronic record isn't taking away jobs, it's creating different jobs.
And again, I want to go back to the website, and forgive me if we keep jumping back and forth, but I thought we could take a look at perhaps some of the courses offered in HIMS in this area. There's some very interesting areas of study that you offer.
You bet.
So let's go back to that website if we can, and let's see, if we go to, what tab do we go to for the courses that are offered?
It should be under Find the Class Schedule.
Okay, there we go.
And
so,
maybe if you just pull up winter.
Sure. And if we pull that up.
Summer's up there.
Yeah.
And then we're going to go to HIMS under that browse button.
Okay.
And when you're on the computer, you scroll down, and we're going to look for, under any subject, we're going to look for Health Information Management. And you click on that, and then all locations will come up. So the courses that are offered wherever.
At all of those locations, okay?
Right, it'll all come up on a schedule. And it starts out with the first course that you should take.
And what would be that course?
That's Healthcare Careers.
There we go, okay.
And so that would be the very first course that a student should take coming into the program. And they would take this with maybe a couple of their gen eds, depending on how many classes they want to take.
So this gives them an overview of how they could
All
specialize
the jobs,
in this area?
right.
Okay.
It talks about the different agencies. It talks about culture diversity. I mean, people don't think about that, but the United States is a salad bowl.
Totally.
We have, different cultures, everything here, that people have to be treated properly. And when you're in the healthcare world, you're seeing all kinds of those people.
Yes.
So maybe that's somebody that comes up to the front desk to check in, speaks Spanish or they speak French. And if you've ever noticed, people will yell at people, I don't understand. Well, they can hear,
right.
They just don't understand what you're saying. So bilingual people are used a lot in the area, but this teaches how you would treat culture diversity and geriatrics. I mean, we're keeping, our doctors are keeping us alive much, much longer than we did 20 years ago. And so we need to know how to properly treat geriatrics. And when they come to the steps of dying and how to treat that, because we're going to see them in the office.
Oh, that's true.
You know, they could come in, you know, walking in, or they could come in from the nursing home. You know,
so even though there's not a whole lot of face-to-face interaction with the patients, you still teach about cultural diversity because it is important with the office staff interacting.
Right, because the patient's going to check in, you're going to get their insurance information, you're going to talk to them about their bill.
Right.
So you may not, you know, be the patient touching them, but you do have patient contact as far as their insurance, they're making their appointment, you know, filing the claim form. So the respect and treating them properly, we teach in that class. And we, you know, try to hit all aspects that they might see. Geriatrics, cultural diversity, those are part of them.
So if a student wants to take classes in this area, are they going to be in the classroom? Can they take them online?
We have all versions. We have online, which you do from home. You don't see the teacher. Everything is done over the internet. And then we have what we call hybrid. And hybrid is kind of the best of both worlds. You come to the class for an hour and 50 minutes once a week, and then you go home and do your assignments. So you have that teacher there for 2 hours or an hour and 50 minutes that we discuss, we do activities, we talk about anything that you didn't understand, and we bring up different areas of discussion that you know, maybe somebody didn't think of. And so in every class we do this because it really, I mean, that discussion and bringing, you know, your peers into it, it's teaching communication.
Yes.
Because, you know, as you know, with technology today, some of the younger ones don't have the communication skills.
Right.
Because they text
because
everything.
Everybody's doing this,
So, you know, it really does that. And then they go home and they do their homework. There are some of our classes that we still offer traditional, which you're there for the 4 hours. So we have all of those.
So they're basically associate's degrees are primarily 2-year programs, but how long does it take for a person to be job ready in this field?
Once they finish their internship, which is one of their last classes, they're ready to start looking.
You could be done in 2 years then, right?
Absolutely. Now, what some of our students do that in the, again, the coding and billing area, they will take they're going for the associate degree, but they will take the courses necessary to get them to the point that they can take that certified prep class and then sit for the exam. That way they are certified. They could be working part-time or full-time and still going to school to finish their degree.
Oh, wow.
Because they'd have their credentials from coding.
And so we did look at the salary, the average annual income, about 55 grand. Do you start at that level, or
That's
is that
more of an experience, an experienced coder? But in Omaha, it's anywhere from 35 to 40 to start.
That's
so
pretty good.
You know, they're getting paid good.
Exactly. So the future looks bright for this area.
Absolutely. You know, I get emails weekly on, you know, Mary, I need some coders. Do you have anybody that's just finishing? Do you have anybody that's certified? They're all over. And the big companies, the national companies that hire people, you may never even see your employer.
Right.
They're begging for people.
Like, give me an example of a big company, like
well,
Kaiser Health?
Catholic Health Initiative would be one.
Got it.
They have coders all over the United States.
Because they have offices and
Everywhere.
medical facilities all over the United States.
Right. So they will hire people that never come to the office. That the claims are all sent to them via the internet, and they loan you the computer because they want their computer and their software and their security and privacy on their computer, and they have an IT person come and set it up in your home, and then you work.
Wow.
And you can set your hours. You can do 4 to noon or 8 to 5, or so that just so you work those set hours.
Right.
but there are several companies that
What about
hire
insurance companies? Do they also hire people who work in their homes?
Not so much in the
Not so,
insurance company,
okay.
not yet. They haven't gone there yet. There's a couple, I have a couple students right now that work from home, but it's due to medical necessity.
Sure.
But it's working for them, so I know the insurance companies can do it, because for these two students, they're being able to complete their job at home in a timely manner without going into the office. So I think it's just a matter of the insurance world hasn't got there yet. The doctor's office and hospitals
Right.
just really started doing that about 3 years ago. And what they do is they have you come into the office for 3 to 6 months. That way they can see your character and your job,
Yes.
you know, skills in that, and then they allow you to go ahead and work from home.
If you go into an interview setting, say you've just gotten your certificate and associate's degree in one of these areas, and you go in for an interview, would it be improper at that first, maybe the second interview or something, to ask, is there a possibility of working at home at some point?
No, I don't think so at all. I think it'd be logical that you'd want to know if this employer allows that.
Right.
You know, with the understanding I'm not going today or tomorrow, but
Yes.
do you offer that at some point in the coding career here? Because there are some that don't. You know, our big
Right.
hospitals do. Some doctors' offices do, some don't. So you would want to ask that question.
And it's probably a matter of preference for a lot of doctors' offices, yes?
Right. I think it depends on doctors' offices. It's a more of letting go of that control.
Right.
And for some, it's space. You know,
Yeah,
they'll do it
it's
because
true.
they
There's
don't
no
have,
room.
They don't have enough space, and they would have to get another office to hire more people.
Yeah.
So
So I'm kind of wondering, and we don't have a whole lot of time left, but I'll put this question out there. It sounds like medical records are supposed to ease the system, but it's actually complicating the system even more. Electronic medical records.
yeah, it still is complicating it. The doctors are still trying to get used to it.
Yes.
Some of them are better than others, but it will make it better. If there is, you know, a catastrophe like there was in Katrina,
Right.
the records are gone.
Oh,
Where in this aspect, they're backed up in the cloud.
Right.
And so we'll always be able to get a hold of those records, no matter what happens to the ground, you know, where they were at. It's just a matter of people get set in their ways and they don't like to learn new things.
Don't we all have that
Exactly.
sometimes?
So once they get used to it, though,
Yes.
you know, it's no different than your paper record, except you're pulling it up right in front of you.
Exactly.
And you might have a lost record where we used to lose files. So, you know, it's the same concept.
Yeah.
But the electronic health records is just a necessity. And in 2015, if it's not done, your money from Medicare will be deducted 1.5%.
Wow. Okay.
So-
It's a big thing to remember.
Exactly.
If viewers want more information, they can go to the website on the Metro Community College website. It is mccneb.edu/HIMS/. And thank you so much,
Oh,
Mary.
Thank you.
Mary Cantwell is coordinator of the HIMS system here at Metro Community College, and we really appreciate your being here.
Oh, well, thank you.
It's a very important field. And thank you for being here. Thanks for joining us today. Our goal at Metro Community College and Metro and More is to better inform you about what's happening here all across the campus so you can be better informed and make wise choices. Thanks again for listening in. Until next time, I'm Margaret Booman.
This has been a Metrovision production produced by Metropolitan Community College.
At Metropolitan Community College, the faculty bring more than just their degrees. They bring international experience, decades of industry expertise, and creativity that transcends the classroom. Through quality instruction and one-on-one attention, we deliver the skills and education students need for success.
In 2012, MCC added $93.8 million to the local economy via brain gain. The experienced option is Metropolitan Community College.